Okay, we're going to talk about myocarditis. Myocarditis is an inflammation of the muscle of the heart. Myo, muscle, carditis, heart. It's certainly caused by a lot of different things: viral, bacterial, fungal. All the gamut. It can cause all of that. So it could be very much a difficult diagnosis to try to figure out what's going on with the patients. The myocardium does get inflamed from these toxins or microorganisms. Chronic alcoholism, cocaine abuse, radiation, some autoimmune disorders also can cause this. So we just really need to be asking the patient if they want to, because these are going to be really sick patients with myocarditis. They will not feel well at all. And they're going to be coming in and looking, as a matter of fact, it mimics so much of an MI, so that we're going to have to be doing a lot of differential type things of trying to figure out what's going on. So getting a good history. Have you been sick? Have you had the flu? Have you had some sort of parasitic infection? How much alcohol do you drink every day? This kind of a thing. Do you have any autoimmune disorders? Trying to get that good history so that we can figure out what's going on. It does affect the muscle tissue cell, and it interferes with the way the muscles stretches and recoils. It just really sort of gets that inflammation down in that muscle tissue. It just sort of swells. It can't stretch. It interferes with how your blood is circulated throughout the body. You pretty much, these patients go into right and left heart failure. And it can also, because of the reduced oxygenation to the heart, it can cause an ischemia there as well, causing some dysrhythmias and some tachycardia. So the signs and symptoms, again, it's going to look a lot like an MI, because here we go. We've got that sharp stabbing or squeezing pain resembling that MI. Sitting up does help relieve the pain a little bit. For these patients, they will be suffering from a low-grade fever, some tachycardia, dysrhythmias, dyspnea, malaise, fatigue, anorexia. They may have pale or cyanotic skin. So, see, they're very, very sick. But still, it's not really clear-cut yet, from just these symptoms when they first present, whether or not we're dealing with an MI or something else. Most assuredly, they can go into right-sided heart failure. They will have that right-sided JVD, ascites, or peripheral edema. What happens is when the blood backs up and backs up and backs up, it goes into in the heart. It goes into the right side of the heart, and then it continues to back up to the superior or inferior vena cava, then into the jugular vein, into the rest of the body, even seeping down, into the abdomen, causing the ascites and peripheral edema and all. The left-sided heart failure, you will hear those crackles in the lungs, so you're going to be listening for those. You will hear the extra heartbeat, an S3 gallop, and then again a pericardial friction rub you will hear as well. I put in a couple of slides. It's just a good picture on helping you understand the difference between what you're going to see from the left-sided failure as opposed to the right-sided failure. Now, we are going to diagnose myocarditis with looking at their blood work. They certainly will have a WBC elevated. They're going to do just a CRP, which is C-reactive protein and sed rate, and that just shows generally that there's an infection in the body. So that starts painting even more of a picture, even though with an MI you can still have these things. They can even have the elevated cardiac enzymes because it can affect that ischemia, affects the heart, some EKG changes. They'll even do a chest x-ray and some echo. They will see that heart enlargement on the echo or chest x-ray, some fluid in the lungs. On the echo, they'll see that reduced ejection fraction on just how that ventricle, how much it can actually push or eject out of the ventricle. So, but when we get enough history and get enough empirical evidence, the physician, the nurses, the team, they will go in and if they suspect myocarditis, they'll get a myocardial biopsy, and they can go in and do that with a needle or a little incision with a scope. But we are going to treat those underlying causes, because if we can get the underlying causes treated, then that's going to help prevent further complications for this myocarditis. And they will need to have antibiotics, especially if it's bacterial. These patients will be on bed rest because we want to decrease the workload of the heart. We want to restrict their sodium because we don't want them to swell more than what they already will be. They will probably be put on like a cardiac glycoside, like digoxin, and usually that's always in combination with some ARBs or ACE inhibitors as well. So and that's just going to help the contractility of the heart. And just got some page numbers here. There is a good chart about beta blocker and digoxin treatment on page 757, your IGI. And you also need to be very well aware when you're given digoxin about digoxin toxicity. And there's a drug alert on page 753 that you need to go read. Now, you know, myocarditis, if we can't turn it around or if it's gone too far, the patient could possibly have to have a heart transplant from this. So our nursing management for patients with myocarditis is to monitor always their signs and symptoms. If heart failure, we're going to be looking at any kind of dysrhythmias. Daily weights is the best way to know how much fluid they're retaining from day to day and even from shift to shift. So daily weights is the best way to do that. We're going to have them on an INO for fluid to know how much fluid they're taking in and putting out. We're going to do heart and lung sounds, listening for that friction rub, listening for the S3. We're going to be listening for the wet lung sounds, for the left heart failure, things like that. We will be getting O2 sats and giving them some supplemental oxygen to relieve that workload of the heart and relieve the tachycardia. We're going to be checking for edema, just another way to know that they're retaining that fluid. Cardiac monitor, they definitely will be on a cardiac monitor and or telemetry. If they have a fever, we want to give them antipyretics just to help. If you have a fever, that also uses oxygen. It also helps increase the workload of the heart, so we want to give them antipyretics for that. Elevating the head of the bed can certainly promote breathing, because if they're struggling breathing, again, that's more of a workload on the heart. And that is the end of the myocarditis. Thank you.